Hello and good day everyone. My name is Mohd Hanif and I'm from Group 9. We are going to present about Dirofilariasis in dogs, and specifically we are going to explain about how to control the disease. This is the list of our members of Group 9. So for the introduction, what causes heartworm disease, which is Dirofilariasis? It is a blood-borne parasite known as Dirofilaria immitis. Adult heartworms are found in the heart, pulmonary artery, and adjacent large blood vessels of infected dogs. Adult heartworms may live up to 5 years, and during this time, females produce millions of offspring called microfilaria. And these microfilaria live mainly in the small vessels of the bloodstream. As for the content of the control, we have the first one, treatment drugs. The second one, annual heartworm testing. Third, insect and vector control. And the last one, surgical therapy. I'm going to pass this presentation to Justin T.
Studies have shown that administration of doxycycline in combination with ivermectin provided more rapid adulticidal activity than ivermectin alone. It also showed reduced Wolbachia numbers more effectively and efficiently than the doxycycline alone. Doxycycline is used to treat several human filarial diseases and has been the subject of several canine heartworm therapy studies. Studies showed that doxycycline administered with ivermectin at 10 mg per kg for a 12-hour interval continuously for 4 weeks have reduced or eliminated Wolbachia organisms for up to 12 months. Melarsomin dihydrochloride is able to eliminate worms less than 4 months old with a 98% success rate. However, when treating, the dog may be harboring heartworms at different stages of development. This poses a treatment challenge because of the limited knowledge about the effects of melarsomin against heartworms less than 4 months of age.
Next is diethylcarbamazine and styripyridinium. Diethylcarbamazine has been found to be active against adult ascarids in cats and dogs. However, a combination of diethylcarbamazine for 3 mg per kg and styripyridinium chloride for 5 mg per kg gave protection against hookworms, ascarids, and heartworms in dogs. Lastly, moxidectin. Topical moxidectin is approved by the FDA to eliminate microfilaria. No adverse reactions due to high microfilaria counts were observed. The drug is branded as ProHeart 12 and is able to provide year-long heartworm protection with 1 injection.
The next control method is insect vector therapy. For mosquito control, it is used to reduce the transmission by having mosquito abatement programs. For example, application of chemicals such as adulticides to control adult mosquito populations. Public education and mosquito surveillance are useful in mosquito control too. An educated public is extremely important to the successful implementation of any mosquito control program. Public education campaigns are organized and media are utilized to promote mosquito control. Individuals and departments should also coordinate effectively when providing mosquito abatement services. Moving on to mosquito surveillance and disease monitoring. Larva surveillance allows us to identify and treat breeding sites. Besides, execute effective mosquito surveillance programs weekly to collect the mosquitoes using variety of mosquito traps at control zone.
Next, larvae control is one of several methods to control insect population by reducing their breeding habitats by applying biological control to stagnant pools and water holding containers. One example of common biological control is fish that feed on these mosquito larvae. In addition, larvicide can also be used to kill mosquito larvae. Next, repellent or insecticide can also be used to control the population of insects. For instance, the use of topical formulations such as dinotyphorans, permethrin, paraproxephon, also known as TPP. This formulation is commonly used for the purpose of repelling and killing mosquito, which are the disease vectors that are capable of transmitting L3 larvae of Dirofilariasis that causes heartworm disease in the dog.
Next, annual heartworm testing.
Annual heartworm screening is recommended for all dogs, even those receiving preventive medication. Dogs should be tested as early as 7 months of age before starting heartworm prevention.
It is important that your dog is screened for heartworms before starting on a preventive medication. Your dog may appear healthy, but on the inside, heartworms may be living and thriving. If a heartworm positive dog is not tested before starting a preventive, the dog will remain infected with adult heartworms until it gets sick enough to show symptoms. Heartworm preventives do not kill adult heartworms. Also, giving a heartworm preventive to a dog infected with adult heartworms may be harmful. If microfilaria are in the dog's bloodstream, the preventive may cause the microfilaria to suddenly die, triggering a shock-like reaction and possibly death. Other than that, even though your dogs are on heartworm prevention year-round, annual testing is still necessary to ensure that the prevention program is working.
The fourth control for dirofilariasis in dogs is surgical therapy. This is done on severe class 3 classes that have clinical signs such as generalized loss of body condition, more extreme exercise intolerance, labored breathing, and a pot-bellied appearance. This is also the only option for dogs that has class 4 heartworm disease that normally has a condition known as Kamal syndrome, which is caused by excessive amount of heartworms to the point that they block the flow of blood into the heart. As you can see from the name surgical therapy, surgical is involved in the heartworm extraction. An incision is normally made into the jugular vein to get access to the right atrium. Then, worms are extracted by using retrieval device until there is none left. Make sure to check multiple times at the surgery site to confirm that all the worms are cleared out.
Because these patients are extremely ill and cannot tolerate anesthesia very well, several alternative protocols to gas anesthesia have been developed, in which some clinicians pre-medicate with butorphanol and lidocaine, then administer propofol to effect. Meanwhile, others may combine physical restraint with local anesthesia over the jugular vein. Alright, that is all from us. Thank you for listening.